What's up, everyone? Dr. Dan over here, and we got Bree, who is our photographer, right? She was on one of the other videos that we filmed. You just had an event last week, video event?
Yeah, alumni weekend, just taking pictures.
Taking a whole bunch of pictures, right? So she's in the office today. We're going to videotape this appointment here, but she's complaining of some headaches and what else?
Just neck pain at like the base of my skull.
Neck pain at the base of her skull. And what were you doing during this event? You were...
I had cameras on both of my shoulders and I was just taking
a whole bunch of pictures, right? So as a photographer, we shot a video on how to hold the camera the right way. You're implementing some of those, right?
Yeah.
But one of the things we're going to talk about today are the front and the back arm lines, right? So basically, people carry a lot of tension up in their neck and their shoulders, and what happens then is that your upper neck muscles, they start to get really tight, and it can actually cause pain radiation, sometimes nerve compression up in the cervical spine, which can then cause headaches and discomfort up to the front of the forehead, around the side of the forehead, just all throughout, right? So we've already done a little scan on her. We've palpated her neck, her shoulders, her right side, specifically right side of her neck. She's got some big trigger points and muscle tension spots up in that right shoulder. So we're going to do a little myofascial release to help break that stuff up. And then we're going to go through and get her adjusted again today. Last time we worked on you was probably about 4 to 6 weeks ago, long time ago. That's all she really needs to be worked on once every 1, 2, 3 months, kind of depending on how stressful she puts her body through these different positions, right? So that's what we're going to do here today. All right, so sit up super duper tall. And right off the bat, we can feel just a little bit of tension in, actually left side has a little spot right here, and right side too. And then most of your pain was kind of like central, right in the base of the skull, right? So we're going to do some myofascial release to both of the lateral sides of her neck to help kind of decompress and elevate her head. And after that, we'll go through, we'll get her adjusted, and we'll see how she feels right after we're done here. So one of the things that I use with a lot of my patients is some Sombra cooling lotion, it's called. And it's SOMBRE. It's really awesome cooling lotion. They also make a heat one as well. And it's a good, clean lotion that helps us to decrease friction on the skin as we go through and work out some of her suboccipital muscles up in the upper portion of her neck. And you feel this big kind of bump right there, right? And again, one of the things that happens while she's moving and grooving, how many pictures did you take? Probably thousands?
Yeah.
Thousands of pictures. Neck starts to get real tight. Suboccipital muscles get tight. Some of the other neck muscles, the upper trap muscles, start to seize up, start to compress the neck down. And we're doing some focused up, down, myofascial release with a little movement in it to help us kind of hit all the muscle fibers. She's got a lot of suboccipital tension. All right. Look up straight, down, up, down, up, and down, up, and down, up, and down, straight down. We're going to go about 10 more times, right? Whole way down, up, down. Now we're going to hold. We're going to lean left a little baby bit, up, down, left, a little baby bit, up, down, left, up. Sometimes during treatment, hair gets a little messed up as we move the head throughout all these different positions, up, down, but it's okay. We can fix it after, up and down. Good stuff. All right, sit up nice and tall. And then definitely like right shoulder, okay? I'm going to move this over. Look straight up for me, straight down for me, straight up, straight down, straight up, straight down, straight up, straight down, up and down. Just keep going right through that movement about 10 more times. 9, good. 8, up and down. So common that people get jammed up in their upper necks and their trap muscles, base of the skull. So many people have chronic headaches and neck discomfort, and it's so easily fixable. Sit up tall for me. Up, down, good. Up, down. With some of our neck exercises, right? So in other videos, you can check us out working on some chin retractions and some of our thoracic outlet or thoracic spine exercises to help elevate that head, shoulders, and chest, right? All right, we're gonna work left side out right here. And I'm just gonna kind of pull all this hair out. Gonna get a little of this somber right on the head. Look up, down, straight up, and down, up, down. Sit up tall, good. Tuck chin back like this, right there, back further, right there, good. And just hold right there. Look down slowly. Look up, look down, look up, look down, up, and down, up. And what we're going to do in future videos, we're going to do some self-treatment, right? So we'll show you guys how to work out some of these muscles on yourself. So you don't need somebody to stand behind you and do it. That'll be another post we'll do. Up, down. Okay, up tall, chin back, good. And a couple more right through here. Up, down, up, down, up, down, up, down. All right, hold up tall right here. Let's go straight up, straight down, bend forward now, good. Straight up, down, bend forward, up, down, bend forward, up, down, bend forward, up, down, bend forward, whole way down, up, down, forward. Good job. All right. So, quick little myofascial treatment for the upper. We're going to lift right there. For the upper neck, we're going to do left trap right now and get a little more movement, a little more muscle release in this left neck, left shoulder. Left, right, left, right, left and right, left and right. As a chiropractor, we have to do a couple things. One, we're definitely going to work on decompressing her neck and her spine and loosen all those joints up. But as we do this muscle work, it really helps to make the skeletal adjustments, the manipulations a lot easier after we loosen all these muscles up. And for many people, you might just need to stretch and get these muscles loosened up, and that might help your headaches and your neck and upper back discomfort, neck pain, all that good stuff. You got a little, feel this thing right there. Okay, big one right there, right? And again, when she's carrying cameras around, and it doesn't have to be a camera, it can be anything. It could be a grocery bag. When you hike your neck, your shoulders up into your neck, your trap muscles, they get chronically tight. And even if I'm working and I see a lot of chiropractors that'll hurt their neck because they'll jam their neck or their shoulder up into their neck. And so it's real important. Posture is everything. Ergonomics is everything. Holding your body, mindfulness is everything. Learning how to hold your body in a good position. All right, we're gonna go face down on table. All right. So right now we're just going through checking out our sacrum. Legs look pretty good. Right hip's a little tight. Left hip's good today. Right hip, a little tighter, isn't it? Mm-hmm. So we've got 2 inches from heel to glute here. We've got unrestricted movement in the knee, and right hip's a little tight. We're just going to work out some of the glute muscles right here. The upper glute muscles, glute med, glute min, IT band. And we're going to work on a little hamstring activation. You sit at your desk all day, yay?
Yep.
So one of the things that happens to people who exercise, people who don't exercise, people who sit at their desk all day, sometimes even people who stand. we get what's called like dead butt syndrome, right? The glute muscles get weak, the hamstrings get weak, and then other muscles like the lower back muscles, they kind of tighten up. They get real stiff. All right, let's move that over, okay? So just after a little bit of release in the top of the right ilium right here, we can see how much closer we can get her leg unrestricted. All right, good stuff, right? So a little pressure here. SI joint already moved. Right side still a little sticky, so we're gonna have to work that side out. Let's go through. Arms down for me. Right on the ground. Deep breath in. Exhale out, whole way out. Good. One right here. Deep breath in. Whole way. One more time. Inhale, exhale. Good. One more in. All right, buddy. Can you feel the difference here? Is good. Versus this right side. We've got a little bit. Is it tender right in here?
A little bit.
A little bit? All right, face right side up for me over here. I'm going to move this. Okay? So we're going to do a little lumbar side posture adjustment for her right SI joint, right side lower back. Good. There we go. Other side for me. Left side lower back right here. Okay, cross, cross. I'm going to put hand here, breath in, exhale out. Good, good. Awesome. Flat on back for me. All right, so Bree here is awesome patient. We spent a little bit of time, last year, 2 years ago, kind of working out all her major aches, pains, kinks, all that good stuff. Bad stuff. Now it's good stuff. And bend knee here. And this one is good.
Oh my goodness.
Okay.
That's so crazy.
So, here in the clinic, we treat everything. Ankles, knees, hips, low back, mid back, neck, shoulders, elbows, wrists, all the different complaints, right? Some chiropractors just focus on spine. I'm going to come up here to the front of the table, cool? And we're going to go, Bree's neck's always really fun to adjust because, relax here. She's got nice, good job. All right. Nice big adjustments out of her neck.
My legs are so tight. I'm sorry.
We've already got, so she used to get real bad headaches on the right side, right? Way better. Occupation sometimes causes neck to tighten up, right? If you're working like she did, like she works big shoots, thousands of pictures a day, you're doing way more now than what you were previously, trying to kind of hold your posture in better position. Push down to my hand, relax, push, relax, push, relax. What we're doing, just a little quick stretch for her hamstrings to help that lower back, this left side.
Oh, I'm sorry.
That's okay. Push, stop, push, stop, push, and stop. Turn out. Right, push right into my shoulder. Stop. Good. Push, stop, push, and stop. All right, man. Okay. Go ahead, sit up straight for me. Spin left. We got one more little thing. We're going to do a little A to P, what's called A to P shoulder adjustment. Left side is perfect. We got good glenohumeral joint movement, so shoulder's good. This side, awesome. Little stickier on the right side, and that's good, and that's good also. Okay, so something that would help her to work on throughout the day, a chin retraction and a scapular depression hold, right? So we've done this on so many of our videos, palms up, elbows in, squeeze back and down. As she lowers the shoulders back and down, we're gonna lift the head up and tuck the chin back like this. Tuck chin back now into my hand. Up, 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 right here, and now back into my hand like that. Sit up a little taller. Hold 5 to 10 seconds, and then she can go back to her computer work, video editing, photo editing, website development, all the cool stuff that she does. Every 20 minutes, palms up, elbows in, shoulders back, lift and tuck the chin, right? Lift and tuck the chin. Cool? Awesome. We're going to finish up with a little laser on her neck today, but that's a typical treatment for somebody who comes in complaining of neck pain. She did awesome today, right?
That was good. Thank you.
Blow it up.
Thank you.
All right, we'll see you guys later on.